Do you have issues walking? Do you have issues maintaining stability through dynamic movements? You sometimes have knee pain, ankle pain, or even low back pain? Well, then you may have an issue called leg instability. Today, we will be covering leg instability and the proper ways to get the help that you need. So let's start out with our primary question. Do patients who train their lower extremity have less leg instability and as a result suffer less back pain than patients who don't train their legs? Here's some of the other questions that we will be covering. So what is leg instability? What causes leg instability? What does leg instability look like? What muscles are responsible for leg stability? What muscles are often neglected? What are the most common injuries of the lower extremity caused by leg instability? How does lower extremity training impact back pain? What is the prevalence of back pain in individuals who train their legs consistently? And how can leg training prevent back pain? And the final one is, how can chiropractic care help with your leg instability? So let's start off with, what is leg instability? Leg instability is a condition in which a person experiences lack of control, stability, and balance in one or both of their legs. It tends to manifest itself as unsteadiness, weakness, and the inability to maintain proper control or coordination of their leg movements. Leg instability can have various underlying causes and may affect many individuals of different age groups. So what are the causes of leg instability? There's various factors, and we'll start one by one. The first one is muscle weakness. Weakness in the muscles of the legs, such as leg extensors, flexors, and calf muscles, can lead to instability of the joints in the lower extremity. Weakness in these muscles can cause injuries when stressed in critical moments during active range of motion. Now, there's general joint issues. These could be from osteoarthritis, different deteriorating factors, as well as age-related as well. So there's also neurological conditions. Neurological disorders that affect the nervous system can lead to leg instability. Some disorders that can cause such issues are peripheral neuropathy, commonly found in diabetes, MS, and even a stroke. The next point is injuries. Traumas or injuries such as sprains, strains, fractures, or torn ligaments, which, as we said, aging. And the last one is something that not a lot of people think about, but something as common as weak core muscles can cause leg instability. So what does leg instability look like? There can be muscle pain in the legs, reduced muscle strength, stiffness, lower back pain, balance issues, shakiness in the legs, issues with knees buckling, or difficulty standing or walking. Now, in trained individuals, this may present itself as reoccurring injuries in the spine, poor posture, overly tight muscles, increased aches, pains, or injuries, poor balance, or the inability or proper transfer of power through dynamic movements. Now we're going to cover just the general anatomy of certain muscles and what they're responsible for, so you have an understanding of what is the purpose of training certain areas. So first, we have the hip stabilizers. The main hip stabilizers of the hip are all labeled here. So we have the gluteus maximus, medius, the piriformis, gemellus superior or inferior, the obturator internus and externus, and the quadratus femoris. So a brief overview of what these hip stabilizers do. Now, the gluteus maximus is one of the biggest muscles in the body, if not the biggest, and it's responsible for extension, external rotation, and adduction and abduction of the thigh. The gluteus medius is the primary abductor of the hip. The other hip stabilizers are responsible for extension, external rotation, and stabilization of the hip joint within the acetabulum. Now, the acetabulum is that part in the femur where it kind of meets the actual hip. Now let's move on to the knee stabilizers. There's two areas, the primary stabilizers and the secondary stabilizers. The primary stabilizers of the knee are all the ligamentous structures in and around the knee. The secondary stabilizers are the muscle groups that surround and move the knee during dynamic motions. These can be the quadriceps group, the hamstring group, and even the gastrocnemius, which is the part of the calf that usually has that V shape. And we include this into the knee stabilizers because it does cross the knee joint. The soleus, however, does not, which is the part that sits under the gastrocnemius part of the calf. So what muscles are often neglected in the legs? Primarily, it's the adductor group. And as we can see, that the adductor group has a lot of muscles in this area, center portion of the thigh on the inside. You have the adductor magnus, the adductor longus, the adductor brevis, the pectineus gracilis, and the sartorius. These are often neglected just because they're not worked as intensely or as properly as they should be. These can be anything from doing the machines that kind of close the legs, so the adductor machine. You can do something as sumo squats or even something as Jeffersons. And these aren't worked as often as, let's say, squats or deadlifts. So they are often neglected. And it's important to see how much muscle and how many muscle groups are within the center portion of the thigh there. These are responsible for a lot of hip stability, and if they are neglected, they can cause a lot of knee issues, hip issues, and in the end, low back pain. So now, what are the common injuries caused by leg instability? The first one that we have is ACL injuries. This is the most common injured area of the knee, which is caused by planting or pivoting maneuvers. The second area that it's almost as common as ACL injuries are MCL injuries. These are most commonly injured from a direct blow to the outside of the knee. The next ligamentous structure that can be injured are PCL injuries. Now, these are not as common as ACL or MCL injuries, but they can be injured normally in a hyperextended motion of the knee. And the last one that we have is patellar instability. This can occur from traumatic injuries or underdeveloped quadriceps, specifically the vastus medialis. And the vastus medialis is that teardrop that you see on the center side of the leg. It's responsible for allowing the patella to track correctly through extension and flexion of the knee. So it's important to make sure you do those isolated exercises as well as those dynamic exercises as well. So let's see how leg training can impact back pain. Studies show that average strength of hip abductors, extensors, and knee extensors is lower in patients with low back pain. It's important to note that as with any mechanical structure, biological or synthetic, stability is a key component. When it comes to the human body, the lower half is responsible for propelling us through our 3D environment. When stability is not present, such as weak muscular foundations, other structures take the load. Most often, it is the spine, particularly the lower back, that suffers. Other areas that may eventually be impacted are the ankle, knee, hip, and the neck. The body is just one dynamically connected structure. So when going through these dynamic movements, it's important to have that stability in order to prepare you for any injuries that may happen due to lack of stability. So how does leg training prevent back injuries? Leg rehabilitation or training can help prevent back pain and provide a stable structure for the body to interact with its environment. One thing about leg training that is not often mentioned is that when legs are trained, they involve muscles that are not only in the local muscular group, but they also involve global muscles. For example, something as dynamic as squatting not only incorporates the quadriceps, which is the main primary target, as well as the glutes, but also the hamstrings, the calves, and the intrinsic muscles of the foot. It also involves the lower back and the core for stability through these dynamic movements. For example, when you're squatting with a barbell, to be able to maintain that stability through that dynamic arc or movement, you have to incorporate a global range of muscles just to perform that activity. For many years, the recommended treatment for chronic low back pain has been rest and inactivity. In cases of mild to moderate low back pain, exercise has been shown to decrease low back pain and improve physical function. So how can chiropractic care help with leg instability? The first one is spinal manipulation. Chiropractors assess restrictions and limited mobility in certain areas. These physicians then often apply manipulations to increase joint mobility. If leg instability is the root cause or is exacerbating low back pain problems, chiropractic manipulations may help improve stability by restoring proper alignment. The next way is muscle balance. Chiropractors often work in conjunction with amazing physical therapists in order to help patients improve muscle balance and strength. Weak or imbalanced muscles tend to contribute to leg instability, and chiropractic care is often a part of a broader treatment plan to address these underlying issues. The next way that chiropractic care can help with leg instability is pain management. Leg instability is often accompanied by pain. Chiropractic care can help manage pain through many soft tissue techniques, manipulations, and pain alleviating therapies. Pain relief can help aid in increasing the ability to perform rehab modalities and decrease pain that would normally hinder a patient's ability to perform specific exercises. And the final one is secondary therapies. Chiropractors often work with specific companies that help with improper body mechanics. These can include custom orthotics from companies such as Foot Levelers. These companies provide patients with custom orthotics that are built to help restore proper body mechanics, which are often hindered in patients with leg instability or back pain. So coming back to our primary question, do patients who train their lower extremity have less instability and as a result suffer less back pain than patients who don't train their legs? The obvious answer is yes. Normally at this point in the video, I would offer specific exercises, but it would be improper of me to give therapy modalities that are not specific for your level of back pain. So I urge you to go see your local physician or chiropractor to seek the help that you need and the therapy modalities that are recommended for you. I hope this video was helpful and informative in providing you, the patient, with the best up-to-date information. If you did enjoy this video, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you and have a wonderful day.